focus on the extrapyramidal symptoms, side effects of the antipsychotic drugs. Antipsychotic drugs. So to begin with, a first adverse reaction we are going to focus on is the acute dystonia. So there is acute dystonia. So the time of onset of this is 1 to 5 days. So what are the features of this? The features include there is spasm. There is spasm of the muscles. The spasm of the muscles, and this is of the tongue. The spasm of the muscle of the tongue. Then there is also the face, then the neck as well as the back. So all these is involved. Then we look at the treatment of the acute dystonia. So treatment includes the diphenhydramine. Diphenhydramine as well as the benztropine. Diphenhydramine and the benztropine. So this is in case of the acute dystonia. Next we look at the akathisia. Akathisia. So the akathisia, the time of onset is about 5 to 60 days. And the feature is that there is restlessness. So how do you treat this akathisia? The treatment is by the administration of the propranolol. So there is propranolol, then there is lorazepam. So there is propranolol, lorazepam, then there is also the diphenhydramine and the benztropine. So all this is involved in case of treatment of the akathisia. Next we look at the Parkinsonism. So in terms of Parkinsonism, the time of onset is from 55 to 30 days is the onset. And how are the features? The features is that there is presence of a bradykinesia. There is bradykinesia. There is a rigidity as well as presence of the tremors. So how do you treat this Parkinsonism? So the treatment is by there is dose reduction and there is also change. You can change the medication, change of medication, and there can also be the anti-Parkinson agents. Anti-Parkinson agents. Then we'll move on to something known as a tardive dyskinesia. So we will look at the tardive dyskinesia. So tardive dyskinesia is from months to the years. This was nothing but in case of the tardive dyskinesia. And other thing to note is that in case of tardive dyskinesia, the features, it includes the orofacial dyskinesia. So it includes the orofacial dyskinesia. And as we discussed, the time is from months to years. So orofacial dyskinesia, so it may be reversible with early recognition and drug discontinuation. So when this happens, we need to early recognition as well as the drug discontinuation must be done on time. So how do you treat this TD, that is tardive dyskinesia? So the treatment here is by you give the VMAT2 inhibitors. So what is meant by the VMAT2 inhibitors? So the VMAT2 inhibitors, it includes the valbenazine as well as the deutetrabenazine. The valbenazine as well as the deutetrabenazine. Then we will look at the neuroleptic malignant syndrome. So NMS, neuroleptic malignant syndrome, this is from weeks to months. And we look for some features. The features, it includes extreme rigidity. So there is extreme rigidity as well as there is presence of fever, there is unstable BP, that is a blood pressure. So how do you treat this NMS, that is a neuroleptic malignant syndrome? The treatment is being by the dantrolene. This is the treatment, that is dantrolene. So this is about the extrapyramidal side effects of the antipsychotic drugs. To learn and grow daily like this, please do subscribe.